All right, welcome back to the second day of the Shoning State University Fall 2024 Faculty Research and Teaching Expo. Our session right now is going to be supporting student success, how our School of Nursing is utilizing support staff to increase student success. Christy Sherman, Cassie Smith, Ruby Gray was part of this presentation initially, but is not able to join us today. So now I will turn it over to the two of you.
Okay. So thank you everyone for signing on or being here with us today in person. We wanted to talk a little bit about a project that we have started in the Department of Nursing, or the School of Nursing now. We probably refer it to that as a lot as the Department, but the School of Nursing. We've really been focusing on remediation and interventions to support student success. And so we're going to talk a little bit about how we got here today, why this is so important to us, and what we're going to be doing. This is the beginning of the project, and we hope to be back multiple times, hopefully crossing our fingers over the years, to be able to share how successful it is, because we think it is a good model that could be helpful to other people here on campus. So with that, okay.
It's not working.
Yeah, nothing's working. Restart time. So there we go. You have to use the trackpad. Okay. So let's talk a little bit to start about the history of the associate degree nursing. Starting this program with the associate degree, and wanted to talk a little bit about how we got here. And I think probably a lot of people who would be new to the university do not realize that the associate degree program has actually been here since 1969. We were here with the Ohio University Portsmouth campus. We have been here through all of the transitions and different forms that Shawnee State has taken. And we have faced a lot of challenges through that. And so I think coming through that and that history and being successful gave us the confidence to be able to recognize our problems, name our problems and our challenges and our struggles, and face them head on. So what are these challenges? Well, the Ohio Board of Nursing approves our program. They have a their legislative purpose, it's state law, is that they ensure public safety by approving nursing education programs, pre-licensure programs. And so they do that through many different ways. They do site visits, but one of the things they look at is the pass rate for the National Council Licensing Examination, what we call the NCLEX. You'll hear nurses, if you have nurses in your friends, your family, or your social circle, you'll hear them referred to as state boards. So we have to pass state boards. And there's a certain benchmark that we have to hit. And we've had some difficulties with that recently for many different reasons. We're also an accredited program. We're accredited through the Accreditation Commission for Education and Nursing. We call that ASIN, and that's how we refer to it for the rest of the presentation. They also have benchmarks that we need to hit. There's also the dynamic healthcare landscape. So in 2020, there's some things that happened in healthcare that you may have heard about. And it kind of really sort of threw things into the air. It changed the students we got. It changed how the students that we're getting now were educated coming into our program. It changed who wanted to enter nursing. It created a lot of upheaval that was overlaid on some of these issues that were already happening. So the NCLEX examination is updated every 3 years to reflect practice. And what it is testing is it is asking the question, is the graduate safe and competent to be an entry-level registered nurse? So they revise it every 3 years to ensure it's meeting that standard. There was a major change in 2013, and we're not the only school that started having problems about that. Schools across the nation did. And usually what you would see is a change, scores would dip nationwide, and they come back up. But in 2013, that really didn't happen for many schools across the nation. We were kind of one of them. That was sort of the start of some of our issues. And then in 2023, it changed again with what we call the next generation NCLEX, which was a wholesale revision of how the NCLEX tests our graduates. So you can see here our pass rate. The board standard that we have to meet is 95% of the national average. Sorry, went too far. There we go. So the board looks at first-time pass rates. And this is our aggregated data from 2021 to 2023 and our 3-year average. So this is what the board is looking at with us. This is what ASIN looks at for us. It's the ultimate pass rate, which is basically looking at students who graduate. If they pass on the first time, great, they count in this. But if they are unsuccessful in their first attempt and then end up eventually passing, they can still go into this. So if they ultimately pass, thus the ultimate pass rate. Another thing that we wanted to look at, because we saw it as kind of an issue, was program completion, was attrition. Nursing programs in general are hard. They're really hard. And it's not uncommon to have students leave, but we want to minimize that as much as we can. This is what came from our website here at Shawnee, didn't it? This was the pass rates for health science programs in 2022. You can see how we rank. I do want to point out, this is from 2 years ago. Since then, Bachelor of Science in Nursing is up to 100%. Ruby, or Ms. Gray, along with Dr. Kahn, if any of you remember Barbara, before Barbara retired, her and Ruby put together a project study looking at variables that may impact success within our program. And the only two that really jumped out was the GPA during the AEN program and the ACT reading score upon entrance. The rest of those really didn't seem to have an impact on it. So what this told us is that our students needed individualized support because there was not one specific thing that we could target. So we started talking and wishing and asking Santa Claus for some sort of remediation program that we could do. We've kind of been working on the idea ever since. And then Cassie came along, and I'm going to hand this over to her, and she kind of helped us get started with all of that.
Okay, so my name is Cassie Smith, and I have been working on this little bit of a project with Miss Gray and Dr. Sherman over the summer and into this semester. And it's kind of all started with a literature search and synthesis. So following those best practices, getting into the literature to figure out what it was that we could do to improve outcomes for our students. So we looked at a lot of different databases. We used ERIC, CINAHL, which is our nursing database in allied health, PubMed, PsycInfo, ProQuest Nursing and Allied Health. We also looked at Medline. So we were really doing an exhaustive search. We also consulted the nursing professional organizations and also Dr. Dinty Reed, which is the director of the School of Nursing, brought some really important and interesting information with her about model schools of nursing who have implemented similar programs. So we found that that was really helpful to kind of get us started to think about what this could look like for us. And then we also looked at what I have here is HESI/Elsevier. But this is our standardized exam manufacturer, the developer of those, and they also have online resources for our students to utilize in order to promote their own academic success and learning. Okay, so Dr. Sherman had already spoken about some of the reasons for student attrition versus course failures and some struggle with their academics. And like she said, they couldn't really find a specific thing for our group of students. It turns out that highlight. But some of the different factors that can influence this are student profile, characteristics, their affective factors, so that would be like their cultural value and beliefs, self-efficacy and motivation. Also their cognitive abilities and their metacognition, so how well they study and how well they are able to figure out how to apply what they are learning. Also professional integration factors, so this is a sense of belonging in the professional body of learning, and how well our faculty are even making our students feel like they are eventually becoming, a nurse. They're becoming one of us. The other main thing is socioeconomic factors, and this is something that we really see as a key characteristic, especially for our first generation college students, our students who are adult learners, which we have, I feel like, more of those in this associate degree program, but we do get a wide range. So that's including their family status and what all of the other responsibilities they have in their life. And then finally, the political arena, so everything that's surrounding this. Dr. Sherman had spoken about COVID was a big issue. So all of those things affect each other. And that's really what it comes down to, is this idea of intersectionality. And you can kind of see that with all of the arrows up there. Basically, everything is affecting the other components. So it does take integrated and individualized approach to figure out what's exactly going on with that student and how we can best support them. Okay, so as we were looking through the literature, there were some concepts that we were kind of struggling with to figure out exactly what does this mean. And what we found out is that these concepts have a variety of meanings in the literature. So the first one that we want to look at is nursing student success. It's very easy to just say, okay, well, that's academic outcomes, and that is a very, very important concept or part of nursing student success. But it's also those psychosocial outcomes, their satisfaction, their stress level, psychosocial well-being, how well they are managing the stress of nursing student. The second concept I have is nursing student support. And this is more so a strategy, but just to kind of hit the highlights here, there are a lot of different support strategies. There is mentorship, tutoring, coaching, there is tutoring, or excuse me, I lost my train of thought, remediation, intervention, and supplemental instruction. So the next concept is remediation. So remediation is a very loosely defined concept in the nursing literature. It's used to describe various approaches and levels of intensity of the remediation that they are doing to increase their academic performance. However, as we were looking also through the education literature, we came across this concept of intervention, which was not something that has been explicitly defined in the nursing literature, but it is more appropriate for some of these intensive individualized interventions that we were seeing, and was kind of getting wrapped up into that remediation component. So intervention is, let's get there to the next slide here. We'll get there. Okay. So best practices. We'll kind of talk about this a little bit, and I will show you a model of what I mean by intervention. So that's best practices that we were able to pull out of the literature to support student success is this culture of caring. Again, that's the belongingness and understanding that there are individualized factors that affect student outcomes. The second is evidence-based teaching practices. And I know this is something that the nursing faculty has really looked at in recent years, developing how they integrate different teaching approaches, the use of simulation, and also their examination strategies. The next thing is a tiered model of support with risk identification criteria. This is something that was new to us when we were looking through it, through the literature, so it was very interesting, and we felt like that was something that we could maybe take on a little bit. And then also connecting students to their needed support. So realizing that those socioeconomic factors need to be addressed, or at least they need to be referred to the appropriate services so that they can focus on their academic outcomes. Okay, so this is where this intervention and this tiered model of support comes from. So this is one example, and it's kind of a broad example. It's built on a foundation of a lot of the strategies that we talked about earlier, so that evidence-based teaching practices, connecting students to resources, but also looking at the curriculum, also enhanced assessment practices, and that includes more formative assessments so that we can monitor their progress, and just professional development. Above that strong foundation, we have the interactions that we have with our students in the regular classroom, so those moments that we are interacting with them and teaching them what it is that they need to learn, and that's for all students. On top of that, we have the targeted small group intervention. So if our students several of them are struggling with a specific concept, we can pull them to the side, have that targeted intervention with them. And the tier above that is this intensive individualized intervention. And this is where we really spend the time with that individual student to figure out what it is that's not being connected in their minds, if there's a specific thing or there's an issue that they're dealing with, and how can we remedy that together. Turn this back over to Dr. Sherman.
So how did we go about doing this? It started with Cassie's work within the literature, bringing forth all of these ideas, and we were starting to think about how we could actually integrate them. And we met in the late summer, myself, Cassie, Dr. Lindsay Reed, and Ms. Gray. And we met in the late summer for a series of meetings where we discussed short and long-term goals. One of the other things that we were very particular about making sure that we did was, one thing we haven't said so far is this program right now is being piloted in what we call level 4, which is the last semester of the AD and nursing program. The students that we're working with right now in this program will graduate in December and hopefully be registered nurses on the floor in the first quarter of the new year. So we don't have a whole lot of time. We had to anticipate any sort of barriers and pitfalls and things that may come up within the program and have strategies on hand ready to address them. So it didn't hold up our progress with the program and thus hold up the progress with the students. So we ultimately decided on this integrated approach, and Cassie's going to come back and talk about that. This minute.
Okay, so as she said, we are working with the level 4 students currently, and there are only 10 of them. However, that affords us, I guess, a unique ability to really work with these 10 students in an individualized manner. But there are a lot of different ways that we can determine their progress or their success. This is just one of those things, and this was from an exam that really was given early in the semester. We do anticipate improvements. Just to give you an idea, there are some students who struggle a little bit more than others, and we really wanted to make sure that we were helping them and supporting them in the best way possible. So the first thing that we did, as Dr. Sherman was saying, this is an integrated approach. So as part of their course requirements, they met with me at least once during those first 2 weeks of the semester. Some opted to come in even twice during those first 2 weeks just because they were excited about it. But we had these individualized sessions where we met for an hour and we went over their past performance and we talked. We just formed that relationship and I got to know them and I asked them, what are your goals in life? Why do you want to be a nurse? What is it that brought you into this profession? And where do you see yourself in 5 to 10 years? And that really brought out a lot of enlightening data and also some information that I could use to string along, whenever things get tough for them, I'm able to talk to them again and say, okay, I know it's tough right now, but remember what your goals are and let's keep working towards that. Other information that I gathered was their learning style preference, just to help me cater or give them ideas about how they could approach certain material to better retain that. course performance. And we tried to, at the initial meeting, talk about, okay, well, does that work well for you, or does it not work well for you? And initially, all of them were like, hey, yeah, it totally works for me. I made it this far. As the semester has moved along, those conversations have shifted a little bit. But we, again, it was just about establishing that relationship and making sure that they knew that I was there to help and that there were some expectations for them as far as participating, but I wanted them to feel comfortable. So as we have moved on through the semester, we have been having weekly check-ins. These are pretty short, informal sessions most of the time. Sometimes students will drop by for a little bit longer than 30 minutes. It's usually the time I put in there, but some of them like to come in for extra help with math or their medication dosage calculations, or if there's a certain thing that they're really struggling with. I've also had some students drop in and ask for extra resources to study, which has been something that I didn't expect really starting this out. I thought, okay, we're going to talk about how do we time manage and how do we, approach the content that's there. And I found that there's a few of them that are doing that. And then they're like, okay, what else can I do? They really are wanting to optimize their performance. It's been nice to see. But we always look at their course exam and quiz scores that are current. So everything that's happening in that course, in their courses, to see how well they're doing. They also take adaptive quizzing questions, and we look at those together to identify if there's a specific topic that is really, really challenging for them. And if there is, and there usually is something that we can pick out there, I give them individualized resources that are tailored to their learning style preference to try to get them to engage in that material. So our summative assessment data, this is the data that we hope to collect and plan to look at the end of this pilot. Is their HESI data, so that standardized exam, the graphic that I showed earlier about the 10 students and there were 8 that were over in that left-hand category. They will take that exam again, so we're going to look at that and compare their movement, see if they are, increasing those scores like we hope. We're also going to see how satisfied they are. I will say, I think anecdotally from Ms. Gray said they've talked to her a little bit and said that they feel very supported, which is really what I was hoping for. Of course, we're going to look at their NCLEX RN, the state board's pass rate, and we're really hoping that we
So where do we go after this semester? What are our future goals? So we recognize that there's going to be a limited amount of change that we can do with students in 15 weeks. So our ultimate goal is full program integration and actually start when they come through the door at level 1 and that we can maximize the benefit that we're going to get through this. We constantly want to be focused on quality and best practices, so we're going to continue to be looking at the literature and strengthening our methods. And also, we have to continue to recognize that a lot of the literature is not necessarily done at schools like Shawnee State. So we have a very specific and fantastic student population. Incredible. It's wonderful to work here. It's such an opportunity to work here and work and help our students. But they do come with a specific set of needs that may not necessarily be reflected in research that is done on nursing students at, say, a place like Ohio State University. So therefore, we're going to have to be very mindful of taking what we find in the research and when we're making plans to implement it, to be able to implement it in a way that is tailored to meet our students where they're at. Our outcome goals, we want to see increased retention, increased on-time completion rates, and improved NCLEX pass rates. But this column on the right is my favorite. My specialty in nursing practice is in community and public health nursing. And one of the side benefits that we have started to see with this, and that's what Ms. Smith was referring to with Ms. Gray, is we're starting to get these comments about the building of community within our nursing students, and that they're expressing satisfaction, increased satisfaction, and an increased sense of belonging. And I can tell you, coming from community and public health, there's a lot of research that shows when people have connections within communities, they have better health outcomes. And it's just so exciting for me, and I think everybody else too, to see that we also see, maybe not on paper just yet, but we're starting to see increased academic success. One of the things anecdotally that I can say I see in my class that I teach these students with is an increased I guess you would say, risk-taking behavior. Whereas when I ask a question in previous classes, they would all sit there because they don't want to give the wrong answer. They don't trust the people that are around them. Now they trust the other students. And so they're willing to go out there and throw out that answer. And I always tell them it's really important to me for you to give me a wrong answer because then I know where we are. Excuse me. And so then we can fix it and we can go on. But if you never tell me, you're just going to go through thinking something incorrectly. And I think there's always been fear, and we're starting to see that fear go away. So I think it's fantastic that we're focusing on some psychosocial outcomes that's creating this sense of trust and belonging within the students and creating, for lack of a better word, safety within the classroom so that we can, address some of these academic issues a little bit better. And we think if we do all of this, it will have a positive impact on the healthcare system and our community and Shawnee State University. In conclusion, we have a lot of people to thank. And we want to thank Dr. Lindsay Reed and all of her help getting this started, and Dr. Raver and the College of Health and Human Services, and Dr. Braun and all of the administration here at the university for all the support that they have given for this program. And we're just so excited. This is something that has been on our Christmas list for years and years and years. And we're so grateful and so happy and very, very proud of what we've done so far and very proud of what we will do in the future. We think this is really important as we now have the College of Health and Human Services. Whenever you talk about health, not to negate any other disciplines, but nursing is kind of central to health. And so therefore we need an ADN program that is really turning out the brightest and best nurses for all of Southern Ohio and beyond. So I think we're striking when the iron is hot and hitting it at the right time. And we think this will allow us to have a huge impact on our students, our community, and healthcare at large. Onward to the future.
All right. Do we have any questions?
So I know it's super early, but I know there's some anecdotal kinds of things. So maybe you can talk a little bit about the one-offs that we're having right now that we see as successes that are keeping us going to the end.
I know, I feel like I can tell stories until, I guess, till tomorrow, but there's been one student who I'm so impressed and honestly shocked because she's been on it earlier. She's done all of the lessons and she's reading and she's doing all of these things. And then she was like, hey, can I have some case studies? How can I apply this? So I talked to them about, moving away from remembering and understanding to applying. And I kind of showed them that Bloom's taxonomy and getting them to understand that you've got to move yourself. We're trying to help you. We're giving you the resources, but then you've got to move yourself up. So whenever she was asking that was impressive. A lot of them have gotten into the adaptive quizzing software, and I would say, 7 out of the 10 self-study. They're in there quizzing. And I get to see it. That's been nice. And I have one student who came to me, and Dr. Sherman was just telling me about this the other day, but the student had already come to me. She said, Cassie, she said, I think I impressed Dr. Sherman because she did. She said she was talking about, was it PAD?
Yeah, we're talking about PAD. I do case studies in class. And we do virtually no lecture. The only time I would really do lecture, I ask them if they have questions in the beginning, and then if they really don't understand something, we'll bring a case study and go to lecture. But we're talking about PAD, and she raises her hand and she says, wait a minute. Isn't that the same thing as a heart attack, just in a different spot in the body? And I'm like, yep, exactly. Yeah. And I said, so everything you get, symptomatology-wise, has to do with the fact that there is a lack of blood flow. I said the same exact thing. And I said, pre-becoming attractions is also an ischemic stroke. And she said, yeah, I can see that. Yeah. And I said, oh my gosh, I'm so excited. You're getting it. This is what I've been trying to get you to do. And I guess she was very proud of herself. She should be very proud of herself. And she's not the only one. It is fun to teach. It's always been fun for me to teach. I love my students. But it's particularly fun when you can watch, like, the power coming back on in a neighborhood. Around the room, the different lights will come on, and it always seems like they take a deep breath. And they'll go, oh, I'm a little bit, I don't want to build them up so much because I'm afraid it might not necessarily show up on like test scores and things like that, but it's working. I can tell you, I've been here since 2007. The connections are being made. The thinking. We always talk about you have to think like a nurse. They are starting to think like a nurse. Do I wish they started thinking like a nurse right after Labor Day? Yes, but it's happening. And I think that's one of the things when we're talking about full integration is that we want the power to come on in the neighborhood in semesters earlier than this, because we can then take them farther. But it is so much fun because they're starting to get it and they're proud of themselves. And the more proud of themselves they are, the more risk. I think we need to start talking about it in terms of risk. It is risky to sit in a room and have somebody who's teacher, professor, whatever, with all the alphabet soup after their name, ask a question, and then you're like, I think that was 60% know the answer, but I don't want to make a fool out of myself. That takes a lot of guts for a student to overcome that and answer that question and take the risk of being wrong. And I think we've not seen that in the past, and that's what I like about the sense of belonging and the community building and the trust that's being built through this, that they're now willing to take that risk.
I think the adaptive listening does help that, because they, at the beginning, whenever they started taking these, they have to take 100 questions a week, which isn't a whole lot really considering everything else that they're doing. But I do that on purpose because I want them to come in, let's look at this together. And they were nervous about it. They didn't like it because they were like, man, I did really bad. They were like, but I was like, hey, it's okay. Like, it's totally fine. We're just going to look at this together. And it's the way that you approach it and tell them, hey, I struggled, or I've been there. You're not going to get everything right now. Or, hey, let's look at this content. Well, of course you didn't know. You haven't covered that yet. And giving them the room to say, okay, it's all right. I'm still on this journey. I'm still making progress. And I think that has been really instrumental.
I have children, or a child who's college age, so I'm around a lot of kids getting ready to go to college, and one of the things, when they ask questions, I'll say, the most important thing is that it's okay to be wrong. It's more important when you're learning, and especially I think in a university when we're trying to have you do these, very high level thinking things, that you go in with the attitude that if I'm wrong, I'm going to be big, loud, and proud wrong. And we haven't necessarily had that culture of being wrong. I've had students say, well, I'm trying to figure out what you want. That's not important what I want in a skills checkoff or in a paper or something like that. I want you to be big and loud and proud of whatever you think it is. And then we've got a starting point to go somewhere. But if you are trying to camouflage that or something like that and not wanting to take EAQ questions or do some of these other things, or even I've had students who study things they know backwards and forwards because they're not comfortable being uncomfortable. And learning and growing and becoming a nurse is all, and it will be for the rest of their career, is about being comfortable, being uncomfortable. And because you're going to have to call the doctor and be uncomfortable and go, hey, I'm not sure we should be doing this for this patient. They have to learn to be comfortable with the uncomfortable. And I think that's something that we've been able to achieve really well this semester, and far more than I would have anticipated. And I think it's made a tremendous difference. If we could do it earlier, I think it would be even more incredible.
Sounds like a lot of what you're doing is creating that psychological safety in the classroom and out of the classroom. I guess I'm thinking that we've had these conversations with other programs and trying to figure out how to help students get be comfortable being wrong, be willing to see where they're at, and know that that's part of growth. That's a hard. I mean, all of our students have had 12 to 16 plus years of experience of education. Like the goal is to be right. So there's a lot of cultural undoing. I think particularly in the program. Do you have any tips for other educators listening about like what are ways you can create that space? What are ways that, from a pedagogical standpoint, I guess, like in your structure in your classroom, what are the things that you do to help make that space? Because it is a tension, right? Students, they know they have to. I mean, your program is a perfect example because they know they have to meet a benchmark. But it can be really hard to hold the space of like, I've got to be right on this, but you're telling me it's okay to be wrong. How do I get there? I mean, I think that's a lot of building that classroom community and sense of safety in the space. So I don't know if you have any thoughts of what you've seen working or intentional things that you've done or ways that you've addressed that or would like to address it.
So, I'll be real honest, and I think that's a big piece of it is being honest. When I was back in nursing school, we used to talk about therapeutic use of self a lot. So I think you have to be honest. And I will say, I have a very superficial understanding of the word pedagogical. So I think I know kind of what you're getting at, but if not, please correct me. But I think that's one thing. I don't know everything. The last time that I was a hospital nurse was in the year 2000. And then I went into community and public health nursing, and which is just as difficult, but it's a little bit different. And so they're going to go and see things in their preceptorship, and I'm going to tell them, I don't know, let's look it up. We look up a lot of stuff in class. The other thing I think is to redefine success. So you kind of get a sense of who your students are and the ones that are really hard for to speak up. If they do it, I praise the daylights out of them. One of the things I struggle with is that it is very important to tell them that they're wrong, but I try to say things like close but not there yet. Or let's think about it this way. So it's kind of constantly coming up with new ways to say, well, that's wrong, without them going, that's the one thing I don't want to see is the, okay, well, I'm just going to sit here and be quiet. No, because they're usually not 100% wrong. They're 80 to 85% wrong. And so if we just tweak little pieces of it here and there, then we can get you to 100% right. And the other thing that I tell them a lot, nursing, it's very rarely that you are 100% right. They'll always ask things and they get mad at me because my answer is always, well, it depends. Who was the patient? What was going on? What's the history? What's this? What's that? That kind of thing. And not this class, but a few classes ago, one of them said, do you ever answer a question with a straight answer? I'm like, no, never. Don't know how to do it. Because everything is so specific. So I think that's the other thing too. It's creating a culture of not searching for the one right answer. It's creating a culture where the idea is, the answer is, it depends. And I think one of the things that's kind of rough in nursing is we do, and I like the new next gen that we have because I think it captures this a little bit better. But before that, the NCLEX was testing students in such a way that they had to give a right answer that didn't exist. A lot of nursing And I have been an NP too, both as an NP, as an RN, is kind of seeing whether or not it works. All right, well, based on the information we have, this is the best intervention we can do. Let's do it, see what happens, and go from there. I mean, how many times have we went to an NP or a doctor or a provider of some sort, and they've switched around their medications? It's because we've got clinical guidelines that we work with them, but everybody's different. So there's not, even in practice, a right answer. So I think this search for this mythical right answer that doesn't exist is another thing that is a little bit difficult, and I won't say that I'm good at it, because you have to get them to the right answer for the test, but then once they're past that, there's no right answer, but it becomes the focus in the classroom that defeats everything else.
I think that's very good.
I think developing curiosity, because I know we get really tied up around the right answer, but really what we're creating is what's called clinical judgment. And that's where the dialoguing and talking out loud is really important in the classroom. Because when you just come up with the right answer, you're the expert, but I don't know how you got there. So it seems really mystical.
Right.
And so there's no safety, because you can't even figure out how to get there.
I think that's what you were saying about, like, when you talk out loud and explain, like when you were speaking about, Cassie, around metacognition. So in other words, a lot of the pedagogical piece, if you will, is like doing that. You're reflecting it back, but you're probably walking them through that. And it depends is my favorite answer to that question.
And I think there's a certain artificiality in nursing education that comes from that right answer. And we were talking about, talking it out with other people. And I think one of the things that is really helpful that maybe haven't had as much opportunity to do with, especially in today's hospital environment since post-COVID, is interdisciplinary work. You know this, but maybe some other people don't. My son has ADHD and autism, and he has sensory issues. And I knew those things as a nurse, but I didn't understand them until he was in occupational therapy. Looking at autism and ADHD from my personal experience, looking at it through the OT lens is life-changing for these patients. And I didn't see it that way. I was not taught that way as a nurse. So I think as we're going forward in things, I think the more nursing students can see through the different eyes of the different disciplines. I mean, I think Compass's sensory OT program that we at Shawnee State, I think it's there used to be a commercial that said, "But for Ohio State." And so for my son, it would be "But for Shawnee State." It's made a world of difference. And I think if we could get nurses to see some of that things, we would interpret patient behaviors differently. We have issues with workplace violence in nursing. I think we may interpret those a little bit differently and have a different set of interventions in our bag that we could maybe do. So I think this curiosity that she was talking about, it just needs to expand and kind of spiderweb its way out until it encompasses everything. But the right answer has to leave the picture before we do that. And I think students want to hold to that as like a security blanket, the right answer, the right answer. But when the right answer goes away, finding the right answer on the test becomes a whole lot easier. Because you have this confidence and competence that I understand what I'm reading and I can answer to it. I've had some students in the past who've had it, and I have changed the answer on tests before that I have control of. I don't have control of the HESI. So I'm like, I didn't think about it that way. Yeah, that's right. So I always tell them, when we do test review, if you can argue me out of it, I can change your grade. Because that encourages them also to really think about why they put that answer. Can I talk her into an extra point?
They just took an exam for her class. And they were like, "Hey, do you think Christy would talk to me about that exam?" I said, "Yes, I do. I think you should go talk to her." They were like, "I think I got one of those right." I said, "Hey, go for it." It's funny. I will say though, just quickly, this group, they have made improvements. One thing I struggle with is that day, me coming in to talk about study strategies and skills, and I think I kind of mentioned this in the presentation, they're like, oh, this has worked for me all the way up to this point, and I've made it this far. But they use the same methods, even though we talked about different things to prepare. I don't say all, and some of them use some of the same methods that they didn't do so well. And so I think our conversations have changed a little bit next time. Is now they're like, oh, I probably should listen. You know, I have to say, I've met two that said that to me last week. Like, I probably should listen to you.
There's a tremendous amount of fear in this thing. I have to pass. I have to get the right answer. And so this thing, this is what I do. It worked, and you cannot pry it from my hands. And that's what it's felt like. A lot of just like rip. You just want to go up and rip Quizlet out of their hands. I hate Quizlet because it's all, even though a lot of the answers it gives is wrong, there's that whole piece of it too, but it is still a product focused on the right answer. And I think that has to go away. And I think when that goes away, the fear will go away. And I agree with you. I think K through 12 focuses way too much on the right answer. I know with high schoolers that I know that they have had teachers that tell them that you're going to have to do better than this in college. You're not going to make it in college. You know, I mean, horrible, horrible things. And then they come to college and they're like, my professors are fantastic. I mean, I wrote a paper and I just wrote what I thought. I got an A. I'm like, yeah, we're interested in what you think. That's what we're asking you to write a paper for. We want to understand your thought process. And we can help you make it better. But to go, the whole paper's wrong, I don't think I've ever done that in all the years I've been here and said, oh my gosh, I can't believe you had the audacity to put this nonsense on paper and give it to me. And so I think they come in with expectations of that we are looking for an opportunity to cut them down and for not having the right answer. And they have it's very hard for them to give that up and accept that there isn't.
I give them those questions to take, and my expectation is right. Which I told them too, like, hey, you know, if you don't give them all right, that's fine. We're just gonna spend a little time in here looking at them. And I think that's been something that she'll be like, okay, well, I'm just gonna do this and see what that's that culture of safety. That's a feeling. I tell them, like, you know, you don't have to know.
Learning should be an adventure. And I always talk to them, you know, when they're talking about quizzes and different things, and I just keep doing it, and I keep missing it. And then when I get it, I get harder stuff. And I'm like, yeah, that's how this works. Why do you want to spend hour upon hour doing quizzes or practice questions or whatever that you're going to get 100 on? Why do you want to waste so much time? There's bigger things out there. Let's go find those. And then when you get hundreds on all of those after 2 or 3 tries, then we'll do some more. There should always be something next. When somebody is learning something, I think for nurses especially, I think that's the curiosity piece. What's next? You know, as an NP, I haven't done it a whole lot, but I liked suturing lab. So what can I watch? Where can I go? What continuing ed can I do to learn new knots and this and that and everything else? There's always something next, especially for healthcare professionals. And I think we need to create students that are excited and have that adventurous spirit to run toward what is next and not shy away from it.
Can I ask a quick question about, as you're thinking about the full integration process, have you had any conversations about the role of potentially like peer mentorship or peer support in that process?
That's been a challenge, I think, for the program. Typically, our students who are in these upper levels are still really worried and focused on those grades, which is something that there has been, I would say, little, I think, interest or uptake for this upperclassmen. Just so laser focused on. That's been different. I think it would be very beneficial, for sure, to figure out a way to.
So other universities do use peer mentorship, and we've had good results and bad results. It just depends, and it depends on the caliber of your peer mentors. They do need a lot of support and materials and things, but so again, and I think Cassie talked about this, your peer mentor opens up a level of where they can share and talk about their fears. And so that's the real benefit of peer mentoring, because they'll get into, so what does that professor do, or what is it, you know, or why, or I've had students say, the peer mentors have told me that students go, I think this is ridiculous, I'm not really sure why we're using this. And the older student will go, well, when you get into, advanced med surg, you're going to really need these concepts, so it's important to know them. Or so it's kind of that buy-in piece. I think the other thing that Cassie had the experience of, and you can maybe expand on this, she's got an opportunity to talk to students and correct some myths around the whole thing, because they would tell her things, and then she would get an opportunity to correct it or have a discussion about it. So I'm thinking of your one gentleman that repeatedly came and was not really bought into the whole process.
Yeah. Yes, we've had some that have not really been bought into it. I will say some are a little bit more like we're trying to control them. That can be difficult. Yeah, I will say that he necessary, or I don't need this, or it's not helpful, or am I really going to need this in practice? And that's the one that am I really going to need to know this when I go to the floor? Yeah. Yes, work in the hospital for a very long time, yes, you're going to need to know that. One of them, which this isn't the same, they didn't understand why they needed to understand the differential, the white blood count differential, where they count neutrophils and basophils and eosinophils. We're going over that and talking about it, and I'm like, I don't need to know that. I'm like, yes, you do. Like, I look at that all the time to see where we're at in this infection. Is there a new infection brewing? Is this, what's going on? Or is this more so inflammation or whatever is happening? And they were like, I can't believe that we actually use that.
Again, my biased opinion as the community health nurse, the big thing I see that's a problem with peer mentoring that I personally have had experience with is I think you have to build the community first. There is a certain amount of vulnerability to go up to your peer, and it's usually the smart kids in class that are paired with the kids that are having a little bit rougher time of it, and they have this like exalted view of this student that they think that somehow or another there's some divine inspiration that gives, they don't understand it, they're just blessed with all the answers. And so then you've got that, and then you've got this person who may have spent many, many years in K-12, struggling and being told they're not smart. And so I think you have to build the trust that comes with the community. The other side of it is I see we have a problem getting tutors from the better kids in the class. They're like, I need to study to maintain all of this. And I think if you build the community first, they're going to see, these are my people, and I have a responsibility towards my people. Maybe responsibility is not the right word, but if they don't walk across that stage with me, it's going to hurt me. And I think when you do that, that would get you more people who are willing to be tutors, and it will get you more people who are willing to be vulnerable enough to go, I don't know how to do math. And that's a big one for us. I don't know how to do dosage calculations, and you get down to the problem, and it's basic math.
Yeah. Well, and I think I'm asking too about, obviously there are formal peer mentorship roles, but also the more informal, like creating that culture. So like somebody who's been through the process of working with you, Cassie, who can say to incoming students, hey, actually they're really supportive here. I don't have all the answers, but like, here are some resources that I've made use of, and like, you can feel comfortable talking to them. You can feel comfortable expressing.
That's a good point. And I think we had that thought at the beginning, but I kind of forgot about it. So I'm glad you brought that up. Yeah, I feel like we could definitely, hopefully, that they're satisfied, which I think that they are, and give them back stages, or even community outreach to try to get people to understand how supportive, how much we really do care. I mean, I don't think any of us are here not care. Like we really do care and want to see them. We want them to feel that and to take that out and tell people like, hey, you got the best thing coming at Shawnee State.
I agree, that's a really good point. I think it can help with recruitment. It's one thing, I think we sell the small school a lot, and I think that's a good selling point for us, but what does it mean to go to a small school? What does it mean to go to Shawnee State's nursing program? Well, it means that, you know, we've got our arms to wrap around you, metaphorically, when you come in through the door. You know, we have designed a culture and a program, and you've got Cassie that you can go and scream about Dr. Sherman, and you're safe, and she's not going to run and go, hey, you know what so-and-so said about you. You don't have to be afraid, because I think so much, especially these kids coming out after COVID, so much of the college experience is fear. And you have to push through the fear. You have to become comfortable with the uncomfortable to persist. And we were looking at attrition rates. Anecdotally, I can say a lot of those are people who were capable, just didn't persist. And so I think that could help with recruitment if we can sell this long term after we get the whole thing built out as, you know, this is a big thing. This is something that's unique about us.
Well, and I think too, when you talk about persistence, that community building, a lot of times students drop out because they don't feel connected.
Yeah.
And when they feel like not only faculty, but my fellow students are rooting for me or supporting me or trying to kind of like help me get where I need to go, there's maybe a little bit more motivation to stick it out when it gets hard.
Well, healthcare is a team sport. You don't do healthcare without somebody unless you're in a really different role. So I think starting that from the beginning is really, really important. And I just came from an advising appointment where I was talking to a brand new nursing student and talked about group study, and he said, oh, I study alone. And then I talked about why it's good to study in a group, and I talked about that discussing out loud, but also that we perceive things differently and that we have different takes on it. And I talked about group study really being teaching. Like someone has to go into the group and be the teacher, we have to take turns. And I said, you really know something when you teach it. And so I think to the peer mentoring thing, that's one of the pluses that you really can make the case for peer mentor, is that they really are mastery of their content when they have to present it, because they're going to get asked questions on the spot and as well. But again, that group is a safe group because it's one of peers, and if you can get it right, it works really well.
Thank you so much. I really appreciated this and learned a lot from it. Do we have any more questions or comments before we wrap it up? Thank you. Good job. I'm going to stop the recording. All right.